Good afternoon, and thank you for joining us. I am delighted to have with us today Angela Ginn Meadow, who is a registered dietitian and also a nurse at LifeBridge Health. And we're going to talk today about eating and taking care of ourselves if we have diabetes. So, Angela, thank you so much for joining us.
Thank you for having me.
So let's talk about, because you explained to me, which is fascinating, 10% of the population has type 1, which is a larger number than I expected, but nevertheless doesn't have the same kind of impact as type 2 diabetes, which a lot of people are getting that diagnosis these days. So let's focus on type 2, shall we?
Yeah, we sure can. And that's the majority of the population has type 2 diabetes, and it's mostly known as a lifestyle metabolic disorder. And so it is something we can prevent and manage.
So obviously diet, which is your specialty, plays into this. Does poor diet cause type 2 diabetes? And if it does, what do you do to reverse it?
So, you know what? They are finding there are many factors that put you at risk of type 2 diabetes. I am a walking risk factor. My dad had diabetes, so that put me at 40% a chance. Also, my age, my ethnicity puts me at risk for diabetes. But also, there are some other things, your environment where you live, and of course, your weight. And so understanding your weight and maintaining your weight is very, very important. They say if you even drink just one sweetened beverage and you have prediabetes, it puts you at risk of diabetes up to 26%. And so changing your lifestyle is really key. It really is the foundation. And we know that that can actually help you lower your blood sugar and lower A1C by just eating well, exercising, and sleeping well is another thing.
Really? Sleeping impacts diabetes.
It does. Your sleeping habits and your physical activity. The more we sit, so this desk job that we have actually put us at risk of diabetes. And so it really is for you to have at least 150 minutes of physical activity every day. So if you're only getting around 3,000 steps in a day, you're actually sedentary. We have to get at least 6 to 10,000 steps a day in order for us to be active and also to prevent diabetes.
All right. And now let's go back to what you said initially, which was that sugary drink. People associate type 2 diabetes with sugar. Is sugar the main culprit?
It really isn't. It is the quality of food that we eat. And when we consume things that have very little nutritional quality. So let's think about the things that have good nutrition quality. Those are things that have fiber. That's your fruits and vegetables, your grains, especially your whole grains, lean protein, and also having healthy fats and oils like nuts and seeds. Those are your base. That's what you should be having on a regular basis. And we just don't eat enough fiber. We're supposed to get anywhere from 25 to 30 grams a day. And the American diet supplies about 5 to 10. And so we are not eating enough of those foods that really give us good nutrition, but we're filling up on things that give us poor nutrition.
All right. So fiber, and I would assume you're saying that would mean that you should avoid processed food, food that you're not making fresh.
So I will tell you, they are doing more research about ultra processed foods. That's things that you just kind of pop in the microwave and that are done very fast. They tend to actually have poor negative outcomes on our health. And so if we have things that are fresh and frozen and cooked, that we are actually able to prepare. So for example, you can just easily make a plate. I like to say a balanced plate with a half a plate of vegetables. Those are non-starchy vegetables, a quarter, then no more than a fist size of whatever starch you want. But that starch part should be higher in fiber. So it could be brown rice, it could be potatoes, but they should have the skin on them. It could have, in the morning, it could be oatmeal. You want to find something that has more fiber in it, at least 3 grams of fiber. And then your meat should only be a quarter of your plate. We eat a lot of meat, and they're looking at meat consumption and the risk of diabetes as well. And so people that eat less meat and especially less processed meat. Those are hot dogs and sausage and some of those things we enjoy at times. Those things actually can put us at risk of diabetes.
at risk of getting it. In other words, even if you don't have the diagnosis, consuming these foods can set
Yes,
you up.
it really can. And so we want to prevent it, and it can be reversed, but lifestyle really has to be your foundation. Making these changes of eating well, getting active, sleeping well, are the things, and stress management can actually improve your A1C if you are doing those things every day and if you're living with diabetes. It is more powerful than medicine. So it can lower your A1C up to 2%. I had a patient today, just by making some food changes, she was able to lose 17 pounds.
Wow.
And so we were like, wow, you're doing it on your own by just eating on time, getting active every day, and including things that have more nutrition in you, nutrition for you, and moving out things that have less nutritional value for you.
So, what do you do when you sit down with a patient like the one you just described for your very first meeting? What is your role in helping them recalibrate their lifestyle?
So we really have to do an assessment. And I want to tell you that, yes, I'm a registered dietitian. I'm a certified diabetes care and education specialist. We really look at your whole lifestyle. We understand who's in your family. We understand what you work and what you do. And we really try to find ways to incorporate healthy living throughout your lifetime. So we sit down and say, okay, what are the things you enjoy eating? So what can we make different? What can we add? What vegetables can we add more often? We also say, what are things you like to do for activity? Because exercise should be fun, but we know it has to be a part of your lifestyle. And then lastly is understanding your goals. So when you're diagnosed with diabetes, you should see a diabetes educator at diagnosis. And then often it may be every 3 months, every 6 months to understand your journey. Diabetes doesn't go away, but we can be there to help you manage it. And if you want to reverse it, we have to make sure to keep you accountable for all the things that we have to do to prevent and manage diabetes.
I guess we should also talk about if you don't manage type 2 diabetes, what are you putting yourself at risk for?
So complications range from head to toe, and that is stroke, heart disease, also gum disease, going blind, kidney failure, amputation, and even sexual dysfunction. And neuropathy, that is tingling and numbing sensation you can have in your hands or in your feet. All these things can be preventable with good A1C control. And the A1C is an average of your blood sugar over the past 2 to 3 months, and we like it to be 7% or below. But the higher that A1C goes, that means higher your blood sugar is. It's really damaging you on the inside. And complications are hard, especially when you're experiencing them.
Yeah, those are serious complications you described, ones that nobody wants to face in their life. So, what about people out there who are listening to this who don't yet have a type 2 diagnosis but want to make sure they never get such a diagnosis? What would you say to them? Obviously, you've made it clear about exercise. I got that message.
Yes, you got to get active. I would say you need to get screened. And so diabetes is not something that sometimes you have overt symptoms. Yes, some people do. Some people have the thirst and the frequent urination and blurred vision, but sometimes you can go 5 to 10 years without being diagnosed with it. So get screened, check your A1C, talk to your doctor. If you have prediabetes, do something about it. Don't wait. So you can join a pre-diabetes program, a diabetes prevention program, or you can see a dietitian. They really are there to help you prevent and manage any chronic conditions you may have or don't want to have. And so if we could do it with lifestyle that doesn't cost a thing, you're not paying a prescription for it. Think about that. Take advantage of it because it's really important for you to live well.
Yeah, I should say. So, the message is out there. And am I wrong in thinking that there are more and more people being diagnosed with type 2 than ever before? Is it because we're better at detecting it or because our lifestyles are becoming more sedentary?
Well, the numbers continue to climb. So prediabetes numbers is at 1 in 2 individuals. actually have prediabetes. And
Wow.
we're looking at type 2 diabetes being at 1 in 3 individuals in the near future. It is because of our sedentary lifestyle that really is changing the way that our body is utilizing nutrients. But also, we are in a food swamp of all these food choices, of 24-hour access to food. And so we have to be more conscious of what we actually eat on an everyday basis in order to prevent diabetes.
All right. Well, you've made it very clear to me and given me some really good points in terms of making sure I don't get such a diagnosis, and I really appreciate that. Is there anything we haven't covered you feel is important to communicate?
Well, I want people to understand that diabetes, especially type 2 diabetes, is preventable. And by me just living with the risk factors, I say diabetes is not my destiny. So I'm going to do whatever I need to do in order to prevent it. And if I am diagnosed with it, I'm going to make sure I have the right team around me to help me prevent and manage complications.
All right. You are living proof. It can be managed, obviously. Thank you so much for joining us, Angela Ginn Meadows, who is a registered nutritionist, also an RN with LifeRich Health, and we certainly appreciate it. And very clear information, and I'm going to take it to heart. Thank you for joining us.
Thank you. Have a great day.
You too.